All right, guys, here we are at drug calculation exercises part 2. For a lot of for a lot of us, this might be true, and right, 98% of the time, except when I have to solve math problems. But we are, like I said before, and for some of you might be, why is he reassuring us so much? I guarantee you, there's some people in your class that'll be excellent at ECGs, some people will be excellent at blood gases, some people will be excellent at drug calculations, but probably there's always people in the class who are of all these things, math I've seen make a fair bit of anxiety because it's not like you can just go home and memorize it more like you can the location of the patella. Anyway, flavoring that, enough said. Yes, yes, are you not amused? Anyways, carrying on, drug calculations as we move on. So, some problems here to solve. You have a 23-year-old patient weighing 60 kilograms who requires 2.6 milligrams of Narcan. I'm not sure why it's a surprise, but the Narcan is supplied in vials of 4 milligrams in 10 milliliters. So, poor Timothy here has apparently been the victim of a drug overdose. Normally, we wouldn't give Narcan to someone who's so obviously awake and alert and oriented, but we'll say he is not right now. As we've talked about before, there's 4 milligrams in 10 milliliters, which will translate when we divide or be seen on the vial to read 0.4 milligrams per mil, which is again a very fancy way of saying 1 milliliter. So 0.4, 1 milliliter. So here we go. We're still doing simple drug calculations, just building up a single bolus dose to give to our patient. So the desired dose here is 2.6 milligrams. And in every 1 mil, our volume on hand, we have 0.4 milligrams. So if we do the calculations, we see that we need 6.5 mils. That's a fairly hefty dose of Narcan, so poor Timothy must have had quite an overdose. But he's going to get 2.6 milligrams by 6.5 mils. Next we have Mr. Pitt here. 56-year-old, I have no idea how old he really is. I think he's, yeah, somewhere in that age range. He weighs 70 kilos, and he requires an older drug that's still sometimes used in ACLS, but mostly in the hospital, 1.5 milligrams per kilogram of lidocaine. So for every kilogram that Brad weighs, we need to give him 1.5 milligrams of lidocaine to make his heart better. And the lidocaine is supplied in vials of 100 milligrams in 10 mils, and it typically is supplied as a preload. So some of you are probably already leaping ahead and saying if there's 100 milligrams in 10 mils, that means there's going to be 10 milligrams in every milliliter. And you're exactly right. But for whatever reason, we've left our larger dose here. You could very much very simply you know, cross out a 0 on the top and a 0 on the bottom. Whatever you do on the top side of the equation, you can do on the bottom, and you'd wind up with that 1 mil in 10 milligrams. And you could do it with the 10 and the 100 or the 1 and the 10, and you would get the exact same answer, and give it a try on your calculator. So we're going to give him 10.5 mils. So it's interesting because in this calculation, we are using a little more than the one preload that we're given. And that can happen occasionally. It's just if we did a calculation where we wound up needing 6 of them, maybe something's wrong with some of our basic assumptions. Oliver Platt. I always remember him in a movie called Lake Placid where he was battling a giant crocodile or alligator somehow. Anyway, so for some reason, I believe he's probably older than 55 now, but anyway, he's weighing 90 kilos. And we're apparently going to paralyze him, so hopefully we would have given him some ketamine prior to our succinylcholine, choline, or we'd be guilty of malpractice for certain. So he requires 1.5 milligrams for every single kilogram he weighs of succinylcholine, choline, and the succinylcholine choline is supplied in vials of 100 milligrams in 5 mils. So sounds like we're ready to go. Hopefully he's sedated, or he's going to have a bad day when we simply paralyze him without sedating him. So we do our multiplication here. Our desired dose is 1.5 milligrams for every single kilogram he weighs. And our volume on hand is 5 mils. Now again, we could do that division and get it down to 1 mil. I just wanted to present a variety of and things and show you it works out the same way either way. So in 5 mils, we have 100 milligrams. Now if you divided both of these by 5, you'd get 1 and you'd get 20. So there'd be 20 milligrams in 1 mil. So again, either way you did it, the equation would work out the same. And so we're going to give Mr. Platt 6.75 mLs of succinylcholine. choline. And then hopefully we're ready to ventilate him because he's going to stop breathing. Oh, Mr. Dinorfrio. Yes, who died so tragically in Jurassic World, I think it was. He got eaten by a raptor. But apparently he's back. And he weighs 75 kilograms, and he needs 5 milligrams per kilogram of a new drug that no one knows the name of, drug XYZ, and it is supplied in vials of 500 milligrams in 10 mils. That actually looks a little bit like the ratio for a very old drug called beryllium. If you ever watch E.T., the extraterrestrial, we used to give an antiarrhythmic called beryllium back in the 80s. And I'm not sure how many people it helped because they discontinued it, but it did. If you watch that movie, everyone thinks E.T. came back because of Elliot's love, but it was the beryllium, I'm convinced, that resuscitated him. Anyway, so here we are with drug XYZ. Our patient is 75 kilos. We want to give 5 milligrams of this drug for every single kilogram he weighs, and our volume on hand is 10. And our concentration on hand is 500. But again, we could very easily strike through this 0 if we struck through this 0, maintain our ratio, and it's a much easier calculation. So zeros are often easiest to strike off on the top and the bottom, very easy to do. And no matter if we did it this way or this way, our answer is going to be exactly the same. It's going to be 7.5 mLs. So again, there's a number of drug calculation sheets posted on D2L, probably below this presentation, and work through those. I'll post some more, and in our first class, I'll show you how to get to an Adobe PDF that can, do a whole bunch of these. So now we're going to talk about drip rate. So here we have a fairly common pre-hospital care calculation. We want to give a certain volume of fluid over a certain period of time. And we need to know how many drops per minute we're going to need to get that accomplished, or per second if we're counting like 1, 2 per second. Both those figures will be things we need to know. So the formula for that, the IV drip rate, is the volume to be infused. So in this case, it would be 500 mils of saline. The drop set, so for practical purposes in EMS, that's usually either a 10 or a 60. And 99% of the time, if we're giving a small volume like 500, 200, 100, 50 over a period of time like 10 minutes, 20 minutes, 5 minutes, 99% of the time we're going to be using a 10 drop set here. So our volume to be infused times the drop set over time in minutes is how we figure those equations out, and those are probably somewhat familiar to you from PCP class. So in setting this out here, we're going to give this over 20 minutes. There's 500 mils that we need to give, and we have a 10 drop set. What you're seeing is this gives you how many drops per minute that you need to do. And if you want to figure out how many drops per second that is, you need to divide that by 60. So 4 drops a second. So barely, this equation works out to be barely within the range of countability, I would say. And there's actually apps you can get, I believe, that I've seen that will actually help you count your drip rate. That's all it does, is it sort of helps you match what's on the screen there for drip, 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 drip to to what you're actually delivering. There's an app for everything these days. All right. So here's a sort of practical example for this. Katniss here has probably been stung by, were those wasps in there, jigger jagger wasps, or I don't remember. But anyway, she's been stung, probably is hurting, probably hallucinating. I think she was hallucinating in the movie, but apparently she's nauseated as well because we need to administer 10 milligrams of metoclopramide, Maxaran. Oh, I've got male in here. Sorry, that should be female. My apologies to Jennifer Lawrence. In a 50 ml normal saline bag running over 15 minutes. So again, we need to know drops per minute, drops per second, roughly. And so our IV drip rate again is going to equal the total volume to be infused, which in this case is 50 mLs, times the drip set. And I believe I chose a 10, we'll see on the next page, over time in minutes, which is 15 minutes. So here we go. We have 50 mils. Our drop set is a 10 drop set and 15 minutes. So that's 33 drops, 33 drops a minute. And I'm sorry, there's a mistake here. That should actually be two drops. Sorry, yeah, that did drop. One drop every 2 seconds. There we go. There we go. See, it's tough for me even, but I hadn't seen this slide for a while, which is why you always check with your partner. So one drop every 2 seconds will get us 50 mLs in a total of 15 minutes. And that's a very, very common thing we give, not necessarily just Maxaran, but a number of drugs we give over a short period of time like that. So here we're going to tackle something a little bit different. We're going to tackle a constant infusion. So this would be not where the Maxaran we were giving over 10 minutes, and the 500 mils we gave over 20 minutes. But there's a number of drip rates or infusions that we give that are constant until the patient gets better, until he gets a pacemaker, until things change somehow for the patient. So a good example of this would be norepinephrine. Norepinephrine, powerful adrenergic drug, really, really works on constricting the peripheral arterioles and increases the blood pressure, tends to increase the heart rate too, and all sorts of things. But we give that as an infusion that is not going to be discontinued on the ambulance and may not be discontinued for hours. So this is in contrast to we're getting a small amount of fluid in over a short period of time. This is we want to give the same amount every single minute ad nauseum until the end of time. So we're multiplying, we're putting an extra step in this calculation now. The desired dose will be the amount of drug we want to give per minute in this circumstance. So it might be 0.1 milligrams per minute or 0.1 micrograms per kilogram per minute. Our volume on hand, which again we could use the whole 250 bag if we put our drug in a 250 bag, but much easier to figure out how much is in 1 milliliter. And then in that 1 milliliter, how many milligrams or micrograms. So that's going to, just that part of the equation, if we cut it off there, is going to tell us the volume we need to give over 1 minute. So you could almost imagine that as standing there with a syringe, and we're going to very slowly push that volume over 1 minute. But then we need to give it again and again, the next minute and the next minute. So we use that as an infusion. So what we do once we have that, say it's 1 mil, say we decided out of all this calculation we want to give 1 mil a minute. Then we multiply that by a 60 drop set. Always in these cases, we're using a 60 drop set. Always, always, always. So we multiply 1 by 60, and that happens to be 60 drops a minute or 1 drop a second. And when you're using an infusion pump, that also works out to 60 mils an hour, which makes sense if you think about it. If I'm giving 1 milliliter every minute, then in 60 minutes, I'm going to be giving 60 milliliters. So you see why that 60 drop set, that use of the number 60 becomes quite important and makes things easy for us. And if that's not immediately sort of seeming apparent, don't worry, we're going to go over this and over this and over this. So remember, again, our first step, we've got the concentration on hand, and we convert everything towards that desired dose. Is it grams? Is it milligrams? Is it micrograms? And make darn sure you convert pounds to kilograms, because if you say how much do you weigh, and the guy says, oh, I weigh 100, and yeah, and you don't think about that and simply go ahead and say, oh, it's 100 kilos. I mean, you probably wouldn't make that mistake, because it's a huge difference. But make sure you get the weight in kilograms and convert it, and off we go. So Magneto, 75-year-old patient who weighs 75 kilograms. That's very kind of him to make that so consistent. He's very slowly increasing in weight, perhaps every year. He requires a lidocaine drip, running at a rate of 3 milligrams a minute. So again, this is a drip that we're not going to get in over 10 minutes or 5 minutes. He's going to get that drip, as far as we know, till the end of time, and at least till we release him to the hospital. So our drug is supplied in vials of 500 milligrams in 10 milliliters. And we place all of that one vial in a 250 ml bag of D5W. So the drug is supplied in 510 mils. You place all of that into a 250 ml bag of D5W. But wait a second, isn't that 260 mils now? It is. Yeah, I actually had an argument with someone a number of years ago, like a practicing paramedic, I'm ashamed to say, who said, no, it just gets absorbed. And I'm like, no, it's 2 amounts of liquid. Liquid does not absorb into liquid. So if you add 10 mils to a 250 bag, to do this calculation, you need to do it with 250 mils plugged into it. So best practice in this circumstance is to withdraw 10 mils out of that bag first. Withdraw 10 mils of saline, because you're going to put in 10 mils of your drug. And so you'll still have a total volume of 250 mils. Now, I say that's best practice. You may not always see that done in the field, particularly with very small amounts. So if I put 1 mil or 2 mils or 5 mils, for instance, in a 250 mil bag, it does change the volume. It makes it 251 or 252 or 255 mils. But the difference is rather insignificant for most of these infusions. So again, best practice when you're being tested, take that 10 mils out. When you're on practicum, go to take that 10 mils out. But there may be circumstances where your preceptor says, we've got limited amount of time, limited amount of hands. So again, best practice, we want to make that a 250 mil bag, however much we have to take out to do it. So just a little sideline there about best practice. So we've done what we need to do. Our desired dose is 3 milligrams, but it's 3 milligrams every single minute. We have a 250 mil bag, and we have 500 milligrams. And again, if you did some math here, 500 goes into, or 250 goes into 500 twice. So you could put 1 mil here and 2 milligrams here, and you would be correct. Or, as I was saying before, if this is the equation you wound up with, you could make it a little easier for yourself by striking through this 0, as long as you strike through one of these zeros, and the ratios, because they're the same, you'll get the same answer. So then we take this extra step of we're multiplying it by 60. So we're multiplying by our 60 drop solution set, which we always use for these kind of infusions. And the answer we're going to give is the number of drops per minute, or the number of mils per hour if we were programming an IV pump. So here we have 90 drops per minute or 90 mils per hour. And again, hopefully that makes fairly intrinsic sense. So about 1.5 drops a second here. Ah, Mr. Crow, who we saw earlier in this presentation. You have here a 58-year-old male weighing 85 kilo who requires a lidocaine drip running at a rate of 3 milligrams per minute. This time, the lidocaine is supplied in vials of 1 gram in 10 mils. And you place all of 1 vial into a 250 ml bag. And again, best practice would suggest if there's 10 mils in this drug, you withdraw 10 mils out of your IV bag, so your total volume will again still be 250. So what's changed here is what I was talking about before. Our dosing hasn't changed, and the drug hasn't changed, but the way it's supplied has changed. And that happens quite frequently in EMS these days. You can be working for 3 months and have the same concentration of a drug, and then you show up one day and someone happens to mention or doesn't happen to mention that things have changed. So we had a gram of lidocaine, that's how it was referred to, but we need to convert everything to the same measurement, and we're converting everything towards milligrams because milligrams is the desired dose. That's where we want to keep our eyes focused on that desired dose. So 1 gram equals 1,000 milligrams. Every time I say that, I feel like, I don't know if anyone's seen those old Austin Powers films with Dr. Evil, who says, why have milligrams when you could have micrograms? 1,000 milligrams. Okay, so your homework is to watch the Austin Powers movies. So 3 milligrams every single minute. Every single minute we want to give them 3 milligrams. And we've got a 250 ml bag and 1,000 milligrams, which is the same as 1 gram inside it. And then we'll multiply the result of that times 60. And once again, if you wish to make things easier for yourself, you could strike out these zeros. And or you could divide 250 into 1,000 and you'd find there's a 4 on the bottom and a 1 on the top. So here we have 45 drops a minute, or if we were giving this by an IV pump, we would program it for 45 mils per hour. Morgan Freeman, in the middle of narrating a sunset, suddenly requires some procainamide. I don't think he weighs anywhere near 485 kilos, but you know, who knows? Maybe he's put on some weight last year, COVID weight. So 68-year-old patient, we don't need that number. 85 kilograms, we don't need that number either because this particular one doesn't depend on kilograms. This particular one is simply an infusion. We want to, regardless of how much he weighs, we want to give him 30 milligrams every single minute. Our procainamide is supplied in vials of 1 gram in 10 mils. So some of you are already guessing that Blair is going to want us to convert this 1 gram to milligrams because the desired dose here is 30 milligrams. So 1 gram, again, translates into 1,000 milligrams in 10 mils. So you place all of the 1 vial into a 50 ml bag. Sorry, I believe that should be a 500 ml bag of D5W. We'll see. We'll see which way this calculation goes. If it was a 50 ml bag, very, very important here to withdraw that 10 mils before we're putting that in, right? Because that's a huge, significant amount of the total. You know, if I put 1 or 2 milliliters into a 500 ml bag, very insignificant. 10 mils into a 50 ml bag, very, very significant. All right. So here we have, again, just for fun, just going to go over again, getting rid of zeros. So whatever I do on the top, I can do on the bottom. So I can get rid of this 1 0 here. If I get rid of this one here, and this one here, if I get rid of this one here, and even this 60 here, you could strike through, and all of a sudden, you know, you're knocking down zeros and making your calculation easier. So there's our final calculation again. And again, just illustrating, apparently I did a zero animation. Yeah, very cool, very cool. So all of a sudden we went from quite large numbers to, you know, some fairly small numbers. So we multiply this by 60 drops a minute because we're using a 60 drop set. And the answer we're going to give us is the number of drops we need to run per minute or the number of mils we need to run per hour if we're programming an IV pump. So here we have 90 drops per minute. or 90 milliliters per hour if we're programming an IV pump. Yeah. So this is what I was talking about some time ago, I think. This is a very typical mini drip set. You can see it's always eminently recognizable because it's got, it's got this small little needle going into the drip chamber, as opposed to the macro drips, which are simply a wide mouth right here. So here's an IV pump. You're going to be working with some of these probably mostly in second semester. But very, very typical IV pump. They are all programmed in mils per hour, which is why on the car we rarely have access to IV pumps. But if you're working flight, if you're working in some remote services, and certainly if you're doing intra-hospital transfers, oh, you're going to get to know and sometimes hate these babies because they alarm a lot, some of them, with the least little bit of air in the line. But they're always programmed in mils per hour for a continuous infusion. So that's why it's important for us to be able to grasp that this is 60 drops a minute, but it's also 60 mils per hour. So again, going back to we're on the ambulance, we're just fiddling with our mini or our 60 drop set, and so 90 drops per minute is going to work out to be 1.5 drops per second. And this is just sort of going over stuff I think we've already kind of gone over. So dopamine and norepinephrine are, and you're going to be seeing norepi and probably very little or no dopamine are the kind of calculations where we do this sort of thing where it gets quite complicated, where it's micrograms per kilogram per minute. So our desired dose winds up being micrograms per kilogram, and then we do that times 60 to get the per minute. And if some of you are kind of reeling now, don't worry. Work through the practice equations, and we'll do some live so we can do some Q&A while we're going through them. This is the look I often associate at this point in the lecture from some people, because it is a lot sometimes to take in. So good old Bobby De Niro here. Ooh, he didn't know his weight in kilos. He's giving us his weight in pounds. Oh my gosh. So we have a 68-year-old patient. We don't care about that number. He weighs 187 pounds. We do care about that number, but we're going to have to do some calculations with it. And he needs a norepinephrine drip. So this is a continuous infusion, not going over 10 minutes. It's going forever as far as we're concerned, at a rate of 0.1 milligram for every kilogram he weighs, 0.1 milligram per minute. So we've got a few things to consider here. The norepinephrine is supplied in vials of 4 milligrams in 1 ml. So this would be a circuit, and we place all of one vial into a 250 ml bag of D5W. So this would be a circumstance where, yes, best practice would dictate you would take 1 ml out of the bag to make 249, because you're going to add 1 ml from the norepi. But try it at home. Do the calculation with 250 mils and 251 mils, and you'll see the difference is so insignificant as to be probably insignificant. I'd also say with norepi, we're titrating to effect. So yeah, consider that too. However, best practice again would dictate you take out 1 ml. So here we have it. The norepinephrine is supplied in 4 milligrams, but we have to convert that to 4,000 micrograms, because we're, again, always converting towards desired dose. And that's what we want in that 250, 4,000 micrograms in 250. So that gives us 16 micrograms per milliliter. So in that 250 ml bag, every single little milliliter in there contains 16 micrograms. And that's, we know that because we've divided 250 into 4,000, and it goes in 16 times. So every single little milliliter in that bag contains 16 micrograms. So again, that's going to be useful because we would not wish to do an equation where our volume on hand is 250, our concentration on hand is 4,000. It's a lot of extra zeros and stuff. It's much easier to bring it down to what's in 1 single milliliter. So what is? Now, Mr. De Niro, unfortunately, even though I'm sure he's a very smart man, did not know his weight in kilos. So what are we going to do with that? 187 divided 2.2 is 85 kilos. And you could do the same more or less by chopping 187 in half. So that's going to be somewhere around 94. I think it's 93.5. Take away 10% is about 9. And you're in the range of 85. You can see how that quick and dirty chop it in half, take away 10% can work. If you've got a calculator, why not do the calculation? Now, you may be suspecting at this point that I chose a 187 because it splits down right down to 85, and you could be right. But if he was 84, I'd probably round it up to 85. If he was 83, 82, I'd probably round it down to 80 just for the sake of simplicity. So here we go now. We have our 85 kilogram patient and times 1 microgram per kilogram per minute. And I've left out the 1 because the space was gone, but there's 16 micrograms, excuse me, in 1 mil. But 1 times any of these things is not going to make a difference in the equation. So here we go. And so we want to give him 8.5 micrograms every single minute. So every minute that goes by, we want him to, over that period of time, we want him to get 8.5 micrograms. So we multiply that by our 60 drop set. Oh, sorry, that wasn't quite finished there. So 32 drops per minute, or if we were programming a infusion pump, 32 mLs per hour. Okay, it could be that the purpose of your life is to serve as a warning to others, but hopefully not. Hopefully not. So go through, I don't think I posted too many drip calculations yet, but I will be in the near future. And yeah, start going through those. And we're gonna talk the first day, which is Wednesday, September 9th, I believe. Yes, and yeah, we'll talk about this, that, drug calculations, and where we go from here. Thanks very much.